One thing that was so special was just that they were so hopeful the whole time. When we needed it, they really helped pick us up through that process and encouraged us to keep going.
People wouldn't know how much happens behind the scenes and how much we want them to get pregnant.
We're both very passionate about what we do, and our goal is to help families become families. As many as 1 out of 7 couples struggles with infertility, so this is a really common thing, and there's a really big need for care in our area, just being in outstate Minnesota. Typically for a woman under the age of 35, if she's been trying to get pregnant for a year and hasn't been successful, then that would be considered a diagnosis of infertility. For a woman over age 35, that goes down to 6 months or longer that they've been trying.
So after we were married for a couple of years, all of a sudden we're ready to have kids. Well, we tried for quite a while, and just kind of wondering if there's something wrong or wonder if our timing was off. So we kind of tried for a long time before we started working with Lakewood Health.
When we look at evaluating infertility, we kind of start at the basics, and we may be checking some labs and doing some tests. And for some couples, it may be that we just need to figure out timing. We need to get her cycling and give education on when timing would be appropriate, and that works for them. Other couples may need a little more involvement.
I have 5 beautiful children thanks to in vitro fertilization, and I look at them every day, and they're truly miracles.
It was really nice because when we first started working with her, she'd been through the process, and she said, "I'm not going to waste your time. We'll go as quick as you want or as slow as you want." And at about that time, we'd been trying for probably close to 4 years.
One of the best parts of my job is providing hope for patients, and I don't want to waste their time, their energy, their money, or their emotion. And I tell everybody, I want you to leave my office feeling hopeful, not hopeless.
I've had patients come in that were given a bottle of medication, call me if you're not pregnant in 6 months, kind of a thing. And here I think we really focus on practicing responsible medicine. So if we're going to give you a medication, A, I want to know, are you responding to it appropriately? And B, I want to make sure you're not over-responding. Our goal is one healthy mom, one healthy baby, and I think we do that really well here. And so that's important for our patients to understand from the get-go that, yes, we're going to give you these medications, but there is follow-through that will walk you through that process.
In the end, we ended up doing in vitro fertilization with RMI, which has a relationship with Lakewood Health.
We're fortunate that we have working relationships with several different infertility clinics that provide IVF services from Fargo to the cities. One of the clinics that we work most commonly with is reproductive medicine out of the cities, RMIA.
Really, it was an incredible process. We were both just so surprised at how well Lakewood and RMI work together.
With the IVF process, we are able to provide a lot of the services here during that process, whether it's labs or follicle studies or pregnancy testing after the embryo transfer. By doing that, we're able to save our couples a 2 to 3 hour trip down to the cities and still keep that personal connection.
One thing that was so special was just that they were so hopeful the whole time. When we needed it, they really helped pick us up through that process and encouraged us to keep going. So I am so grateful. I am so grateful for them. We are just so blessed to have crossed paths.
To make that phone call and tell them that they had a positive pregnancy test, and I'm going to start crying, I'm so emotional with this. It's one of the best feelings you can have.
They probably have the cutest story for when they finally got pregnant, and they were driving into work together and put themselves on speakerphone and announced together that they were pregnant, and we could hear them both crying in the background, and we started crying, and we were just like super excited, and it was just one of the most heartwarming stories.
Even still, after we had Layla, they came up to visit her and hold her and just say how excited they were for us, and it was just such a personal touch. I really felt like they cared about Paul and I, so We really appreciated everything.
In the end, money doesn't matter. Once you finally get what you're trying to, and you're so appreciative, and she brings so much joy to our life.
Really, our goal here at Lakewood is to help families become families.